Hello, Dr. Garber. I'm glad to be participating in this reflection video today because DNP 701 this semester has been great. I've really learned a lot. I had the pleasure of working with Kathy Jennings as my preceptor this semester. She got her DNP degree from Case Western Reserve University in 2009. She's worked for Crooling Clinic Healthcare System since 1983, so Kathy really has a breadth of knowledge that she can share with me, and she has. After meeting with her several times, we came up with the following objectives. There are three of them. The first, investigate the Doctor of Nursing Practice prepared clinical nurse specialist's contribution to the interprofessional team through attending planning meetings with the preceptor and participating in and helping facilitate the Carilion Medical Center's exhibits for the Virginia Tech Science Festival. The second, identify the DNP CNS's role's impact on patient outcomes for a specialty population through patient care rounds, discussions with the preceptor, including research on breast support, post-sternotomy, and heart disease in women. The third, evaluate clinical practice and theoretical approaches of care from advanced practice nursing and other disciplines to work effectively in an interprofessional manner in a complex healthcare system through attendance at multiple clinically based conferences and discussions with the preceptor. I feel that overall I was able to meet each objective. I will address each one individually. Addressing objective number 1, I attended 2 planning meetings with Kathy for the wonderfully innovative and collaborative Virginia Tech Science Festival, as well as helped facilitate the actual event. The interaction with the planning committee before the event and the participants and staff that day were very positive. I felt appreciated in my role contributing to this interprofessional team and actually would like to volunteer and do it again next year. Concerning objective 2, I spent many hours with Kathy and had multiple lengthy discussions about the patient population she cared for. I was able to meet a broad spectrum of the staff with whom she works, from nurses to physicians. She shared with me her multi-level role in the nursing research project at Crooling Clinic. We discussed projects that she is working on and also those of the staff she is mentoring. Of specific interest to me was the research project on breast support post-sternotomy, in which several bras were given to post-sternotomy patients and evaluated to see which provided the most support for the patient with the least negative side effects. I also performed a literature search for her on a PowerPoint she was creating, verifying statistics, etc. And it was on heart disease in women. And I actually am able to go see her tomorrow to give the lecture at the Salem Civic Center. Lastly, objective 3. Throughout the semester, I had the pleasure of attending Carilion Clinic's Nursing Research Conference, also the Mindfulness Conference, as well as the Sigma Theta Tau 10th anniversary event, where I was impressed and awed by the lecture Dr. Jean Watson presented. Kathy and I met and discussed each event and how they all had different meaning and usefulness for the advanced practice nurse to expand their role and explore different theoretical approaches to their practice. 2 of the key insights I gleaned from Kathy's preceptorship in the DNP role are, first, that the DNP should be seen as the expert in their field. We discussed that the DNP is a leadership role for nurses in performance improvement of clinical care and the organization of clinical care systems. And because of the clinical nature of the DNP degree, the expertise doesn't always have to focus on the research piece. The second insight is that the DNP demonstrates professional development for nurses. They are the resource support for advanced education in nursing, and the role is highly involved in preceptorships, research mentoring, and organized orientation programs. This has been an eye-opening and mind-sharpening semester. Kathy has been uber available for me and has been a wonderful preceptor. I really look forward to what's ahead in the program. Thanks.